Hello, everyone. My name is Josh Wynn, one of the program managers for Buckeye Wellness out of the Office of the Chief Wellness Officer here at The Ohio State University. We just want to go through a couple housekeeping items, if you will, before we get started. We do have a Q&A function that is available at the bottom of your screen. So if you have any questions for our presenters today, please drop your question in the Q&A function. And then at the end of our presentation today, I'll ask those questions on your behalf. We do have auto closed captioning through Zoom. So if you click on the More button or at the CC button at the bottom, you can pull that up. And additionally, if you'd like to refer to this presentation at a later date, we will be posting this on our YouTube channel for you to review. With that, our presentation today is called Working Parents Burnout Tips and Tricks, where we'll be highlighting the key findings from the report out of the Office of the Chief Wellness Officer and the College of Nursing regarding parent burnout. We'll then review the easy-to-use checklist to determine your level of burnout. And then lastly, provide you strategies that you can use to prevent and improve your burnout symptoms that can adversely affect yourself and family. Our presenters today are none other than Dr. Bernadette Melnyk, Vice President for Health Promotion, University Chief Wellness Officer, and Dean of the College of Nursing here at The Ohio State University, and Dr. Kate Gawlik, a nurse practitioner and Associate Professor of Clinical Nursing here within the College of Nursing at The Ohio State University. Without further ado, please help me welcome Dr. Bernadette Melnyk and Dr. Kate Gawlik.
Thanks, Josh. Hi, everybody. We are so excited to be with you today to share findings from a very important, impactful study that we conducted. Working parent burnout truly is a pandemic inside of our COVID-19 pandemic. The last 2 years have been really character building for everybody, but especially for the toll that it has taken for working parents. So I want to give you the background on how our passion really developed for this topic area and study. About a year ago, Kate walks in my office and says, "Bern, we have to do something a little bit more about parent burnout. I think I'm suffering from burnout, but all of my friends, my colleagues with children are suffering from it too. We have to develop a scale to measure that." And I said, "Kate, do any other burnout scales for parents exist?" And she said, "Yes, there's actually 2 other ones, but they're outside of the US. I said, "Are there any scales specifically targeting how to measure this for working parents?" And Kate said, "No, there isn't." So I said, "We've got to develop then a working parent burnout scale." So we went through a very rigorous process to develop the items for this particular scale. We searched the literature, we got feedback from parents, and we created items that all tap parent working burnout. We then established face validity by giving the scale to working parents, and we also established its content validity by giving the scale to experts in the field to confirm that the items all tapped working parent burnout. Well, we finished our study. We actually put information about the study. We publicized it through Ohio State and some social media channels. We were able to get nearly 1,300 working parents to complete our surveys. We were interested in not only looking at burnout in working parents, but also how did burnout associate with mental health outcomes for both the parents and the children. We put this wonderful working parent burnout report together, and my senior director of marketing and communications, Phil Sagan, said, "Bern, this is data that needs to be shared across the country." Because he said, I can so identify with working parent burnout, and millions of people across the United States could as well. So Kate and I wrote our report with the findings. Phil Sagan pitched it to the Today Show. The Today Show said, oh my goodness, yes, we need to cover these findings and showcase it on the Today Show. So they sent a crew here to Ohio State and to Kate's home, and they did about 6 hours worth of interviews and video with us. I'm going to show you the clip that was played on the Today Show now.
It's a daily struggle.
Some days it's just total chaos.
Playing out for parents nationwide.
Had to do everything on top of your normal duties and then some.
Parental burnout, feeling overwhelmed, overworked, and plain exhausted over long periods of time. A challenge Kate Gawlik knows firsthand. As a working mother of 4 living near Columbus, Ohio, and a professor at The Ohio State University's College of Nursing.
There was one point during the pandemic where I really felt like I was being forced to be this superhuman. I had to be an elementary school teacher. I had to be a caregiver. I had to be a spouse, a cook, a cleaner. I had to be emotional support for everyone. And it's not feasible for you to have to take on so many different roles. And it's inevitable almost that there's not some degree of burnout present.
Which is why she co-authored a new study just released today that found that out of more than 1,200 parents surveyed in the middle of the pandemic, 66% of them reported burnout, a phenomenon that was more common among women and in homes with 2 or more children.
When we talk about burnout, how do you distinguish that from just a pretty rough day or being tired one day?
Burnout in parents is that physical, emotional, over-exhaustion and that feeling of just, I need a break. And I think it's very shaming for parents to think that they can be burned out in this role of being a parent, you know, because obviously we all love our kids and it's too much on us to be asked to do all of these different things.
What happens as a society if we do not address this problem?
I do feel like it's a public health problem. It's not that I'm depressed. It's not that I'm anxious. It's actually that I'm just burned out in this role.
And it can manifest in harmful ways. In some cases, the research shows anxiety and increased alcohol consumption for parents, along with increased likelihood of insults or even physical harm through spanking aimed at children. As for the kids, parents experiencing burnout reported they saw more signs of unhappiness, more trouble concentrating, and increased difficulty interacting with other children. The good news, says Dean Bernadette Melnyk, who co-authored the study with Gawlik, is that there are also strategies that can help. Things like being kind to yourself and lowering expectations, asking for help or talking to someone you trust, and self-care, even something as small as 5-minute recovery breaks.
For parents who are struggling with this feeling of burnout every single day, what can they do?
Take 2 minutes, make a hot drink, sit, sip it slowly, focus on the present moment, count your blessings, not what you don't have. Just 4 to 5 abdominal deep breaths can so relieve stress. It's these types of simple practices that can make a big difference for anybody who's stressed.
A tiny bit of advice for parents everywhere, taking it one step at a time.
Everybody in these chairs, we're all nodding our heads. We have felt that, those feelings.
It's so interesting how they say even just getting up to make yourself a cup of tea is a recovery break. And the researchers also give this checklist. So if you look at the study, included,
Did you make 4 copies?
Have plenty for everybody. And it really tells you where you are on the burnout scale. So it's usable to tell you you're feeling, I feel easily irritated, or I feel that I'm not a good parent. And you can check sort of where you are, and so you can manage accordingly.
Yeah, that's good.
Lowering expectations. I like that nugget especially. By the way, we should mention that you can find this self-check scale. It's on our website, today.com. Check it out, today.com.
Thank you, Morgan.
Thank you, Morgan.
Good to see you. Mr. O.
We were so blessed that the findings and the ability to bring awareness to working parent burnout was not only covered by the Today Show, but went to more than 200 media outlets all throughout the United States. Kate and I are still doing media interviews this week from this study. So here's the bottom line. What we found in our study: 66% of parents reported being burnt out. So again, if you are feeling burnt out, you indeed are not alone. Being female, the number of children living in a home, anxiety in the parent, having children with a diagnosis of either anxiety or attention deficit hyperactivity disorder, and parental concern that their children may have a mental health disorder were strongly related to parental burnout. Burnout was also strongly associated with depression, anxiety, increased alcohol consumption in the parents, as well as the likelihood for parents to engage in punitive parenting practices. And another important finding from our study was that parent burnout was associated with children's internalizing and externalizing behaviors. Internalizing behaviors are depression and anxiety. Externalizing behaviors are aggression, outbursts in the particular children. So now I'm going to turn it over to Kate, who's going to walk us through what exactly is parent burnout, our assessment tool, and some of our other key findings.
Hi, everyone. I'm Kate Gawlik, and I'm just going to kind of expand a little on what Dr. Melnyk discussed in these first couple slides. So really, what is parental burnout? So I think it's normal for a lot of parents on a daily basis. This can change in a moment, where we're feeling very stressed, then very grateful. So I think it's a normal feeling sometimes to feel that parental stress. But what parental burnout is and what differentiates it is that it's this chronic and severe stress and exhaustion that overwhelms your ability to cope And typically what we see, associated with that also is this emotional detachment from children. And obviously this is on a continuum. So as the burnout gets worse, you'll see this, obviously getting worse as well. And then kind of looking at yourself and saying, wow, I, used to be a better parent. I feel like I used to do things better than I'm doing them now. And then just feeling very tired of that parent role, like often feeling like, oh, I don't want to be with my kids, or I don't want my kids to come home from school. So kind of that, again, that chronic exhaustion, but really related to that role of being a parent. So this is some of the things that over the pandemic, we were hearing from parents. And, it is when you look at these things, it just kind of pulls at your heart, and maybe you relate to them a little bit, and that's okay. I think that's one of the main reasons why we did this, was to just let people know that, there's a lot of us that are feeling this way, and you're not alone in this. As I said, in the video, I think it can be very shaming for parents to feel like they're burned out in this role. And I think, to some degree, that feeling of burnout and that feeling of stress is normal. It's just when it really starts affecting your functioning that you need to do something about it. But you can see, you can see that, parents are feeling this and expressing it, especially with working parents. We had a very different role as far as, layering one thing on top of another, as far as the pandemic goes. It was just one more thing that we had to do. So 68% of women felt burned out and 42% of men, which again, being in the mother role, that's a lot different, how we take on that emotional stress and burden often. So you can see the number, or this burnout starts to go up a little bit, and then it plateaus a little and then goes up again. Why necessarily 4 and 5 children, tends to be a little lower, I'm not really sure. I think personally, maybe it's because they get to an age where they start to help a little bit more, so it can take some of the load off the parents. And then we don't have as many parents that we sampled in the higher with 6 and 7 children. Next slide, please. So 77% of parents were burned out who reported that they also had anxiety, so personal anxiety, and we had similar findings with depression too. And then when we look specifically at the children, we know that oftentimes the parent burnout was higher when the children had either ADHD or anxiety, and you can see those were right around 80% and 70%. And then this was one of our, I think, most interesting findings, and actually the strongest association when we looked at all the different factors was actually when the parent was concerned that their child had an undiagnosed mental health condition. So again, this was our strongest association when we looked at risk factors for burnout. So this our third key finding was that parental burnout was strongly associated with depression, anxiety, and increased alcohol consumption in the parent. And that we also saw that burnout was associated with the way parents were parenting their children. So specifically things like insulting, screaming, criticizing, spanking their children. And again, this just kind of shows that higher level of stress associated with parenting that then kind of trickles down to how we're treating the children and how we are interacting with the children. And as Bern talked about earlier, when the parent had higher rates of burnout, they also reported a lot of these different behaviors in their children. So the internalizing behaviors, the externalizing behaviors, and then the attention behaviors were rated as much higher in parents and how they reported this in their children. So this is the actual scale. And this will be available online too. I think it's a little small for a lot of people to see, but you can go through this scale and check where you are on the continuum. So not at all the way up to very much so. And, just to test yourself and see. I think one of the biggest things with burnout is identifying that's what it is. The very first time I heard the term parental burnout, it was almost like a relief. It was like, that's it. That's what I'm feeling. And it wasn't depression. It wasn't anxiety. It was just feeling like, very worn out in the role of being a parent. So this can help you determine that. And then based on what your score is, and we show you how to score it on the report, you can determine where you are on that continuum. And based on where you are, we offer different, strategies to kind of help. This is also a very quick one item that you can do. So overall, based on your definition of burnout, how would you rate your level of burnout regarding being a working parent? And just kind of go through and check. And we know that a score of 2 or higher typically means you could be experiencing some degree of working parent burnout. So the biggest thing to keep in mind with all of this, and Dr. Melnyk's going to go through, some of our tips and tricks to help, but when your symptoms start interfering with your ability to function, concentrate, interact with your children, or, you're finding this is every day, and it's chronic, it's, this overwhelming feeling of that exhaustion, then that is really when you need to seek further help. And Dr. Melnyk will talk a little bit more about that as well. But that's one of the biggest takeaways we want you to walk away from this webinar knowing. But right before I hand it over to her, I'm just going to quickly talk through the image on the left. So one of the biggest things when you're feeling burned out is you need to assess 2 different things. What are your current stressors and what are your current resources? And you need to look to decrease those stressors and increase those resources. And I know if you talk to any parent, you're like, well, I don't have the time. Like, I don't have the time to sit down and do this. But, what I would say back to that is just that, if what you're currently doing is not working, you need to look for other ways to help. So this is a way, and this will be individualized and look different for everybody. So what's a stressor or a resource to one person might not be to another person. So this is going to be very individualized to the individual. Okay, I'm going to pass it back to Dr. Melnyk.
Thanks, Kate. So I'm going to finish with some tips and tricks if you are experiencing any working parent burnout. For one, take good self-care. I always tell everybody, it is not selfish. When we get on a plane and the oxygen masks drop, we are told, put them on yourself first before you put them on your children. Self-care is not selfish and not a nicety. It is truly a necessity in order to take good care of our families. And I encourage you, even through your work day, take some 5 to 10 minute breaks. I call those recovery breaks, short meetings from 60 to 50 minutes to take 5 or 10 minutes and engage in something that brings you joy, an activity that reduces your stress, maybe just some movement or some mindfulness. Be kind to yourself. Working parents need to show themselves self-compassion. Don't set these expectations that you've got to be a superhuman. We're not. We're all vulnerable. We all have our strengths and limitations. Be kind to yourself. If you're feeling burnt out, talk to somebody who you can trust about how you're feeling. If you don't feel comfortable to do that, write in a journal. But just expressing, getting those feelings out really helps. Mental resiliency, like cognitive behavior skills building, coping skills, are really protective factors against burnout, depression, and anxiety. And we want to develop those as strongly as we can. I have a friend who would always say to me, Bern, I'm going to get you a button that says, my lips say yes, but I really mean no. Because throughout my life, throughout my time as a parent, I would often feel guilty about saying no. Again, be kind to yourself. Learn to say no when your cup is full. And then lastly, it's a strength to recognize when we need help. It's not a weakness. And as Kate said, if you find yourself really burnt out, depressed, stressed, or anxious to the point where it's interfering with your concentration and functioning, that's the time where you really have to seek some help. These are resiliency skills. If we get stronger in these areas, research has shown we will have less physical and mental health issues. And if you have never taken a resiliency scale, I'd encourage you, go to this website, take this scale. It'll give you your scores and give you tips on how to strengthen these certain areas of resiliency. Ben Franklin was so wise. He said, an ounce of prevention is worth a pound of cure. We wouldn't send our children into a deep ocean without an oxygen tank. How can we send our children, teens, our college students, ourselves throughout life without building this repertoire of resiliency skills that we know are effective in preventing mental health problems? On this slide, I've listed some really positive ways to help your children and teens to cope. Talking about how they feel. The physical activity piece is so critical. Teaching yourself and your children when you feel stressed, anxious, or depressed, how to stop and say to yourself, what was just going through my mind? Is it helpful? Is it true? Because probably it's not. So learning how to catch, check, and change negative automatic thoughts into positive is really key to feeling better. Positive self-talk is key. Deep abdominal breathing is key if we put it into practice several times a day. I had the blessing of serving on this National Academy of Sciences, Engineering, and Medicine expert panel. We put together freely accessible micro-learning modules that are based on cognitive behavior therapy for children and teens. If you access these modules, they can help both your children and yourself. Kate and I also have a current study going on right now with the use of these modules. If you are interested, I'd really encourage you to go to this website and participate in this particular study. Lastly, vitamin G. If we take and give a dose of this every single day and teach our children to do the same, we'll have less stress and improved mood. I encourage all of us, limit screen time. There's so much negative news that is happening. The more we take in, the more stressed, depressed, or anxious we feel. And finally, maintaining a sense of structure, routines, and planning, especially physical activity, family activities, can really help. Lastly, our moods affect our children. So remember, please take good self-care because we can't continue to pour from an empty cup. Prevention and early intervention is key. There is hope. Rainbows truly follow rain. And Hunter says, with mad and love, love always wins. Please feel free to contact either Kate or myself. We would be happy to follow up with you and answer any last questions that you might have. Thanks so much for joining us today. Kate, I don't know about you, but I've got a couple minutes to stay on if anybody has any questions.
Thank you so much, Bern and Kate. I know as a parent of 3 amazing, beautiful children, this was absolutely necessary. We do have a couple questions in our Q&A that, if, like you said, if we have time, we can go through those real quick. For those that do need to pop off, you will be getting an email from the Office of the Chief Wellness Officer as a follow-up that provides all the resources that were provided today, as well as a Qualtrics post-evaluation. So first question here. An individual was curious with the research if there was any findings or differences for parents with children that have any special needs and differing disabilities.
That's an outstanding question. And unfortunately, Kate and I did not look at that in this study, but we plan on conducting more research, and that's an excellent item to bring in. That we'll plan on doing that with our next survey. Thank you.
Excellent. I think this is a timely question, especially with everything that has happened this week. What advice do you give to help parents to keep everything that's going on in our world today into perspective? How can we get past the concerns and get some balance and hopefully end up saying everything is going to be all right?
Kate, do you want to take that one?
Yeah, I think that's a really great question. And I think that's a really tricky question. You know, as parents, I feel like when the pandemic started, it was almost like we lost the sense of control that we had. So it kind of moved from, one thing to another. Whereas, this year, even we were still battling so many feelings of having loss of control, from never knowing when our kids were going to be in school. It was just kind of this constant moving thing. And I think it comes down really to even writing down prioritizing what's important to you. And even myself, I love my job so much, and I love work, and I feel so fortunate to be in the role that I am. But I think sometimes, being that we've been through this and that our kids have been at home with us so much, it can be hard when you're starting to prioritize what you're doing. And so always kind of maintaining that focus and making sure that you're doing what is right for you and your family. But I think that it's still going to be hard. And I think that we still have a ways to go through this before we hopefully get back to some kind of sense of normality. But so it's caused this need, and we have to be adaptable, and we have to continue to be flexible. But really sitting down and kind of looking at your family and what is best for you and your family, and then taking action to make sure that happens.
Thank you.
That's great. Any last question, Josh? Or?
Yep. We've got one more here. At what point do you go from, utilizing the tips and tricks that we went through today to actually now seeking clinical help?
Yeah, I think it gets back to that red flag warning that Kate and I discussed. If you find yourself to the point where that burnout, that stress, that anxiety, those feelings of depression, they're interfering with your concentration, your judgment, your functioning, how you interact with your family, then it truly is time to seek help. There is no shame in occasionally needing some mental health support. So I'd encourage you, if you're at that point, talk to your primary care provider. Call our employee assistance program, because we really do have great counselors available to confidentially provide some help for you. But don't wait. Don't wait till it gets into a crisis situation. Seek help at that tipping point.
And I would also say, just to very quickly piggyback off that point, is kind of evaluate, how are you feeling? Is this a chronic feeling? Are you feeling it every day? Because that normal day-to-day parenting stress is a normal thing. It's that point where, you don't want to be with your children anymore, or you wake up in the morning exhausted at the thought of being with your children. So it's some of those key indicators. And if it's happening, how many days of the week is it happening? And kind of take it from there.
Excellent. Well, thank you. Well, that was all the questions that we had. Bern and Kate, thank you so much for all that you do for not only the university, but our OSU community. For those that are still on, like I said, you're going to be receiving an email from the Office of the Chief Wellness Officer that provides all the resources that were mentioned today. If you have any questions for Bern and Kate, you can respond back to that email or reach out to them personally, and we'll make sure that that question gets answered. Other than that, thanks everyone so much, and you all have a great rest of your day. Bye, everybody.
Bye, everybody.